Good afternoon, everyone. I'm Lauren Ordway-Evans, staff to the Southeast Florida Regional Climate Change Compact. Thank you for joining us for this exciting session. Before we get started, we have a short video from Palm Beach County Commissioner Melissa McKinley highlighting resilience efforts in the county.
I think a community's toughest challenges to responding to climate change are financial and political. We have a large contingency in our country that doesn't believe in climate change, despite seeing an increase in torrential downpours and flooding and tornadoes and hurricanes and wildfires, all of those things that are signs of increasing temperatures across the globe. Too many people deny that they exist. And then the other thing is it's going to cost money to address this problem. So financial and political, I think, are our two biggest challenges. So anything that impacts the water tables is having an impact inland, as in addition to having an impact on the coast. Climate change also, we're seeing significant increases in the strength of natural disasters, of hurricanes that are coming our way and across the state of Florida and across the country. A lot of our infrastructure in the Glades community is very old and not built to withstand those kinds of natural disasters. So I'm really concerned about climate change. I think that they're gravely concerned about what the future looks like for them, what we as the current middle-aged to older age adults in this country, how we're leaving it for the future. They're seeing an increase in insurance rates. They're seeing an increase in the impact to their health. They're seeing a difficulty in finding places to live that are affordable. All of that is impacted by not having a resilient community, and I think they're worried about that. So I think a lot of people are shocked to learn that Palm Beach County in the western side, which is the area I've had the pleasure of representing for the last 7 years, is the 5th largest agricultural county in the United States. The top 4 are all in California, which makes us the largest agricultural production area east of California. So that sweet corn that you just ate this last Thanksgiving, those green beans, the sugar that was used to make your apple pie and your pumpkin pie, that was all grown in Palm Beach County.
Thank you, Commissioner McKinley. And now let's dive into the session. Calor, Science, Stories, and Solutions for a Rapidly Heating Region. As a quick reminder, there will be an opportunity for audience question and answers at the end of the session, so please use the Q&A function to submit your questions. To moderate this discussion, we are honored to be joined by Jane Gilbert, the first ever Chief Heat Officer appointed in Miami-Dade County, a role that is vanguard not only for our region, but for the world. In another first, Ms. Gilbert also served as the City of Miami's first Chief Resilience Officer for 4 years. Prior to her work as a public servant, Ms. Gilbert managed the Miami Foundation's civic leadership agenda on sea level rise, oversaw Wells Fargo philanthropy and community affairs work in South Florida, and served as the executive director for 3 nonprofit organizations in the greater Miami area. Jane, thank you so much for being with us. Over to you.
Thank you, Lauren. I am very excited to be a part of this year's Leadership Summit and look forward to hearing from our panelists today about how climate change and increasing urban development patterns are driving an increase in extreme heat. But before we get started, I just want to start off with a video from one of our partners, WeCount. And then I'll finish introducing today's session.
Yo trabajo en el campo, en la agricultura. Y nos levantamos a las 4 a.m. todos los días. Antes de las 7 o a las 7 ya estoy en mi trabajo. Pero el transcurso de cómo va aumentando la calor, el cuerpo va resintiendo. Como uno agachado y todo eso pega el rayo del sol en la espalda. Aunque yo cargo siempre mi agua en mi carro para ayudar al riñón. Pero llegó el momento que ya no resistieron. A veces me meto debajo de la camioneta porque sombra así no hay.
¿Alguien?
Sí, necesito pintar mi casa.
¿Pintar mi casa?
Sí.
¿Cuánto paga
Como
por hora?
11.
En una ocasión estaba yo en una escalera pintando y hacía un calor bastante intenso. Perdí el control y caí de la escalera de un segundo piso y eso me pasó a raíz de la intensidad del calor.
Mire, en el campo, todas las verduras, ¿quién lo hace eso? ¿Quién lo trabaja eso? Somos nosotros los emigrantes, ¿verdad? Si no hay personas que trabajan, pues no hay comida para las demás personas. Y ahí no puedes buscar una sombra, ¿verdad? En las nurserías no lo dan protección a los trabajadores. Ahí sí uno tiene que ir preparado, ¿verdad? Con su camisa de manga larga, con su sombrero. La propuesta ahora es lograr una ley para dar una protección hacia los trabajadores del campo.
Agua, sombra y descanso. Eso es lo que estamos pidiéndole.
Si el gobierno lo aprueba esa ley, va a todos los emigrantes, a todos los trabajadores. Si no vamos a organizar, si no nos vamos a levantar a exigir, y entonces, ¿quién lo va a hacer?
¡Qué calor!
Hay veces quedamos sin agua y nosotros queremos el agua porque ahora hay mucho calor.
So thank you, We Count, for sharing this video that serves to center our dialogue today around addressing heat risk for those who are most vulnerable in our communities. And as you saw, there are more deaths that occur in the United States as a result of extreme heat exposure than any other weather-related heat risk, more than hurricanes, floods, or forest fires. And we know that heat-related illnesses and deaths are grossly underreported and undercounted. The National Oceanic and Atmospheric Administration cites a 30-year average of only 143 deaths annually due to heat, and the Centers for Disease Control cite an average of 702 deaths annually over a 5-year period. However, researchers looking at excess deaths during heat waves have found that we have as many as 12,000 deaths annually historically nationwide, and this number could increase to 110,000 or 50,000 annually by 2100 under high and medium emission trajectories, respectively. And just in October, the LA Times estimated the number of heat deaths at 6 times what was being reported locally by health officials. So this is how we know that heat risk comes to be named the silent killer. And we also know that extreme heat impacts are lower income and historically discriminated against populations more than others. If you can't afford your air conditioning, work outside or in hot conditions inside, and must live in a highly urbanized area with very low tree canopy, your chances of experiencing heat stress, injuries, and death are much higher. In this session, we're going to explore the science, hear more stories, and discuss actionable solutions to address heat. So our panelists today, I'm very much looking forward to hearing from, include Robert Moleda, warning coordination meteorologist and South Florida of the South Florida Weather Forecast Office of the National Weather Service, Oscar Londoño, executive director of We Count, Tom Phillips, researcher, educator, and advisor from Healthy Building Research, and David Hondola, the newly appointed head of Heat Response and Mitigation Office in the city of Phoenix. So Robert, we're gonna start off with you for some good science grounding. So your forecast office of the National Weather Service encompasses the whole region of the Southeast Florida Climate Compact. Can you tell us about some of the temperature trends you've observed over the last 2 to 3 decades?
Yes, good afternoon, Jane, and good afternoon to everyone. Pleasure to be on this panel. Yeah, over the last 2 to 3 decades in the South Florida area, we've seen an increase in the average temperature of about 2 to 2.5 degrees. And that's fairly consistent with many areas. So, we're not alone here in South Florida in this. This is something that's occurring in many parts of the country. Can't say everywhere, but many parts of the country. May not seem like a high number, 2 degrees, that doesn't seem like a big deal, but we're talking about an average here over a 20 to 30 year period. So, the averages, of course, are made up of extremes on both ends. And, of course, that also includes extremes on the high end. So when you take that into consideration, 2 to 2.5 degrees is, it's significant. We know that, of course, that's also represented in the high temperatures. In other words, the maximum daily temperatures. The averages of those have increased as well. But also, and this is something that maybe doesn't get as much attention, is the minimum temperatures. In other words, nighttime, early morning temperatures probably have increased by a little bit more. In other words, a higher rate of increase in the minimum temperatures in Southeast Florida. And that's largely attributable, I think, to the urban heat island. And this is something that's been observed in big cities all across the world, where, of course, these highly urbanized areas have, they're warmer than the surrounding areas. And that's especially so at night, when at night, the heat is not released as efficiently in areas that have a lot of concrete or asphalt compared to areas, that have more grass or trees. So again, those are things that are important because, higher nighttime temperatures means that there's less relief from the daytime heat.
Yeah, great. Thank you. That's very helpful. And in South Florida, from May to October, we consistently experience days of 90 degrees and above and a heat index of over 100. So hot days and nights are really nothing new here. But so how do we warn people around the insidious risk of extreme heat so they can take this hazard seriously and promote preventative measures that they can take? And I'm going to add a second part to this question so you can answer them together. And then how do you see the criteria for heat watches and warnings evolving over time in Southeast Florida?
Yeah, exactly. We're in an area where it's consistently hot for most of that period from May to October. So it's, in some ways that helps as far as people understanding, what the effects of heat are. But at the same time, it's kind of like a double-edged sword. People maybe can sometimes take it for granted. Yeah, okay, it's hot here during that time of year. We know that. For example, the difference between the average summer temperature in South Florida, and I just use Miami as an example, but this applies to the entire region, I think. The difference between the average Miami temperature in the summer and what's considered the highest 5% of temperatures is only 3.5 degrees. We have a very small, very low range or variability in the summer temperatures. In other words, it's either going to be warm, it's going to be hot, or it's going to be really hot, and the difference is not that much. So the challenge is, where at what temperature, what are the temperatures that really are significant, that we really need to be getting the word out. And I think, that's one of the things that we really need to be looking at closely. And I know we are. And related to the second part of the question, I see, any changes to the temperatures or thresholds for heat advisories and heat warnings being significantly informed by data. In other words, by actual incidents of heat illness, comparing those incidents, days, numbers, et cetera, to what the actual temperatures were, in that area at that time. And I think, we need to have a greater understanding of that data, of that health data that can really inform the scientists when it comes to being able to really hone in on temperatures, heat index that really are dangerous to not just a small section, but really to a significant sector of our population, and also in areas that are more vulnerable to heat, such as highly urbanized areas, outdoor workers, etc. So I think that's really what I'm looking forward to, is having more of that data that we can really use to directly plug into the science and to come up with better, hopefully, better criteria for heat warnings and advisories.
Yeah, that's clearly a big priority. And as I mentioned in my opening comments, how we're really missing some of that data and good data, not only on the numbers of heat-related illnesses and deaths, but how and where they're happening and to which populations. And so I do think that's critical information. I'm going to turn over to Oscar. Again, thanks for that great video to tell stories of your members. So advocates say there's a lack of awareness around the heat risk of extreme heat is a big reason why it's so deadly. This is really a preventable thing if we can get the right information out to the right people, is what some advocates are saying. How are you working to increase awareness about this risk with agricultural, construction, and day laborers in South Dade?
Thank you, Jane. Happy to be on this panel with all of you. Yeah, as you saw in the video, this issue is deeply personal to our members who labor out in South Dade and in South Florida. A couple of years ago, back in 2017, 2018, we began to get a growing number of concerning reports from members, people who were working out on roofs and construction sites, plant nurseries, food farms, beginning to talk about sort of like heat becoming a growing problem in their lives and in their workplaces. We know living in South Florida, heat can sometimes be normalized, and that's part of the problem. But these workers were coming in saying that they were getting headaches, nausea, some of them had fainted, nose bleeding. And because we don't currently have any existing labor protections for Florida's outdoor workers, many of them were forced to continue working until some of them collapsed. And part of our work was a response to see what do we do in the midst of this growing crisis? How do we effectively respond to what's going to become a growing problem every single year? And part of that has been awareness and outreach. We know that while we wait for a law to be passed, in the short term, what can we do to make sure that workers understand the deadly risks of heat? How can we make sure that workers understand what heat illness is? What are the symptoms of heat illness? How to spot it in themselves or in their coworkers? And what kind of first aid measures to take if they or a coworker are experiencing heat illness or even more deadly heat stroke. And so we've tried different kinds of strategies. This past summer in June, we launched Calor. It's a worker-led campaign that has two goals. One goal is to educate outdoor workers, help them to understand the deadly risks of heat, and take adaptive measures whenever they can to protect themselves and their coworkers. Second goal is to win local, state, and federal protections. And so in terms of awareness, the first piece is we think that workers are the experts and they're the best messengers, because workers are the ones at the front line of the problem. They're the ones having to labor out in the extreme heat, in the farms, the fields, the roofs. They're best situated to know what adaptive strategies would work, what would allow them to continue to produce and work effectively, given these conditions. And so what we've done is a series of trainings, including one intensive 8-hour train the trainer, where we bring outdoor workers across all of those sectors to learn about mapping heat hazards, identifying the symptoms of heat illness, taking first aid measures, where they simulate what it would look like for a worker to respond to another coworker fainting or collapsing because of heat. And then, of course, what are your rights under local, state, and federal law, including OSHA rights? And the idea is to create a network of worker leaders who can go off to their family, their friends, their coworkers, their neighbors, and share what they've learned. Make sure that they're the ones at the front line solving this problem whenever they or their coworkers are facing this problem. The second one is direct outreach. We have organizers and member leaders who are tasked with going out directly to where workers are. We understand some of the challenges with reaching workers, especially it's hard to reach workers in agriculture and construction. So we dispatch our staff and our worker leaders to go to the farms, the fields, the construction sites, the day labor corners, wherever workers are that are vulnerable to extreme heat. And we have short conversations around heat. We have flyers in Spanish, but also in native Mayan dialects. And then we also invite them to workshops and meetings in our office at times that are easy for them to access, whether it's evenings or weekends. Whenever they're available, we accommodate their schedules, understanding that the importance is making sure that if a worker wants to learn their rights, they have access to a place where they can learn those rights. Second is we have a radio station, a community radio station called Radio Poder that broadcasts on FM radio in South Dade in both Spanish and in native Mayan dialects. This is a big thing for the migrant community of South Dade. Many of them are native indigenous from Guatemala, from Mexico, and don't speak any of the dominant languages in South Florida. And so a lot of traditional communications, they don't receive or they don't understand. On top of that is the issue of literacy, that there's a significant literacy problem with a lot of migrant farm workers who can't read or write. And so our radio station is a tool, an educational tool that allows us to dispatch this information directly to where workers are when they're on the commute to work, on the commute from work, or if they're able to have their radio at the construction site or in the farm. Third is, in terms of building awareness, is building that cross-sector coalition. We know that, and we've seen that this is an issue that touches so many different kinds of fields. There's a stake for public health officials, for environmental leaders, for labor leaders to be sort of leading the fight against this issue. And so part of our work about awareness is not just educating outdoor workers, but educating a broader cross-sector of allies and stakeholders. And then we know that, that the outdoor workers often get their information from sources like Telemundo and Univision. So making sure that we're out there doing that media coverage, sharing stories so that workers see themselves in this reporting and begin to denormalize this issue and see it as the extreme crisis that it actually is. And lastly, I would just add another important component is employer outreach, making sure that we're partnering with responsible employers, with government, because we know that there are some employers who are doing the right thing. And so they can be lifted up as a model for how other employers should follow the lead. While we're waiting for protections, what can they do now to protect their workforce? Because we are talking about the sectors and industries that are often the economic engines of South Florida, construction and agriculture. So I think all of those different pieces is how we've been trying to tackle the issue of awareness.
Amazing grassroots work. And certainly your work would be a lot easier, and I know you've been advocating for this, is that employers are required to inform and protect their workers. And OSHA, Occupational Safety and Health Administration, recently published an advanced notice of proposal rulemaking on heat injury and illness prevention in outdoor and indoor work settings. These are the first steps towards developing a federal heat stress standard. So based on your experience with your membership, what suggestions would you give the rule makers on developing this standard?
Yeah, I think the first recommendation is that rulemaking and policymaking in general can often be disconnected from the people that are affected by the problem. And so making sure that this entire process is they're consulting with workers and worker organizations on the front lines. The second is we've had a series of meetings with outdoor workers to try to get a sense of what would they want to see in a desired rule. And we began first with what is actually happening, like what are you actually being offered at your workplaces around water, shade, rest, and education. Two, we compared other examples of what's being done across the country and across the world, whether it's the state legislation in California and in Washington, and also adaptive measures across the global South. to begin to pull together ideas of about what a Florida rule could look like. And what came on with a lot of sort of similar threads. One is heat education, making sure that when temperature is very high, whether it's 80, 90 degrees heat index, that trainers, supervisors, crew leaders are training workers in the languages that they understand on how to spot heat illness, how to respond, where the first aid kits are, what a first aid emergency response looks like. Two is making sure that you're doing maybe hourly reminders and finding some kind of mechanism for doing that. Two is access to cool, safe drinking water. And so although water rights are currently protected, we know that in a lot of farms and fields, the water might be unsafe to drink. Water might not be frequently accessible, or water might be actually far from where the farm workers are actually laboring, and they're not given the time to actually go and access the water without some level of consequences. Three is access to shade. And so there have been very innovative, creative strategies about how, even in an open field and an open nursery, how you can actually provide shade to workers so that when they do have a cooling down period, they can do it not under the sun, but under a tent or a tree or some kind of covered area. And then a paid break time, generally 10 minutes every 2 hours, where workers can cool down, can rest, can drink water, and then can return back to work. And then lastly, we know that rights and law without enforcement are not really rights to begin with. And so making sure that there's necessary kind of investment from government, both in terms of staffing, investigative resources, so that when workers actually sort of file a complaint because there's non-compliance, when a worker says this law is not being complied with, that government is actually coming in, working with worker organizations to make sure that we have those necessary corrections. And so that's what we're seeing that the workers want. And we think it's common sense, life-saving solutions that are already being piloted elsewhere, and that hopefully with this OSHA process, it'll be piloted nationally. The issue though, of course, is that the OSHA process can take 6 to 8 years on average. And so in the meantime, our push is that local and state governments can be leaders in piloting solutions now while we wait for a federal standard.
Thank you. That's great. And there are a couple of states out in the West that have led on that, and we can be working together here locally in South Florida towards those standards. So David Hondola, thank you for joining us today. While you're relatively new in your role as heat officer for the city of Phoenix, you have many years of experience working with local and state governments on heat mitigation related research while at Arizona State University. What are some lessons learned from working alongside local governments and university partners to address heat? And secondly, how valuable was and is this kind of cross-sectoral collaboration and cultural organizational?
Thanks, Jane. It's great to be on with you as co-adventurers in this new journey for local government heat response. And I really enjoyed the conversation thus far. Rob, we share your concerns here in Phoenix that the summer forecast options are hot, very hot, or extra very hot. And I have great appreciation for the challenges around communication there. And Oscar, boy, so many of the points you were mentioning really resonate with some of the work we've done here with community-based organizations. And I think, this framing of awareness, I was glad how you talked about that. And I'd love to see us as a community be more specific as we're asking these questions. Whose lack of awareness is it that we're really trying to adjust in our dialogue? I appreciate your perspectives there. So to answer your question, Jane, you referenced earlier that there was discussion about the type of health data that are available, the records, and more desire to have the how and the where. And we are very fortunate here in Maricopa County that our Department of Public Health has been a leader in this space for a long time. They have an advanced heat health surveillance program that provides us some glimpses into that how and where, and being able to bring people around those data to talk about those data, I think has led to some important lessons. And I might even be able to answer your valuable question with a dollar amount. So I'll draw from two examples. One is that the Arizona Republic, which is the major newspaper in the state here, used the Maricopa County Department of Public Health records to publish stories about people who had died from heat, 30 different individuals They published stories about it. They collected information from friends, family members, and we convened heat stakeholders to read those narratives. And we asked them, where in this story could your organization have intervened to block the causal pathway that led to this terrible outcome of a heat-related death? And that was a very hard conversation, not only because of the subject matter, but because we weren't very successful at finding those intervention points. And we were in a public setting, and emergency managers at that meeting actually voiced, like, I am not sure that it is my job to be part of this conversation right now. And that, the gap was there. People were just exposing the gap, that it was not clear whose responsibility, whose accountability that was, which I think those conversations and awareness played out over and over again have led to the existence of Jane's position and the position we have here in Phoenix. And I think there are many other de facto heat officers in New York City and elsewhere that are leading in this space, even not by title. So I think we're seeing that lack of accountability and responsibility that is starting to turn. And then the question, of course, is what do these de facto or named heat officers do? And again, working with the Maricopa County Department of Public Health records, we tried to examine how the number of heat deaths was or was not related to year-to-year changes in weather. There's this idea, well, maybe we have more heat deaths in hot years. And in the time period that we had records for, that did not appear to be the case. Years that were moderate or even cool by our standards had some of the biggest spikes in heat-related deaths, which reinforced to us the importance of social vulnerability factors as a major part of the story. And we are very aware that if we are not thinking about the fundamental social services that provide housing and food and water, some of the topics we heard about already, we're really missing the boat in trying to move that all-important indicator of heat illness and heat death. So like right now, trained as a climatologist, thinking about heat interventions, the topic we were just discussing yesterday is how do we have more volunteers on the street trained to use Narcan appropriately? Like it doesn't feel like a heat topic immediately, but it is very much a heat topic.
Yeah. Oh, absolutely. Those being far more vulnerable and not able to regulate heat. So now that you are working in Phoenix, it'd be interesting to hear what your priorities are on mitigating heat in Phoenix. And can you give us an example of a successful heat intervention and particularly how equity, to your point, how equity was built into it? And then finally, just sort of, since you come from the research world, how are you building, thinking about measuring success as you move forward?
All great questions. And yeah, we could all talk for hours about they're such deep questions. To finish answering part of the previous question, I realized I missed. So the question you asked was, how valuable was this cross-sector collaboration? And according to the City of Phoenix Council and their budget decision last year, the need to catalyze more cross-sector collaboration was $2.8 million. That is what they had in their climate and heat readiness investment in the city budget. Wow. So to put a dollar amount on your answer, some of which is for the heat office and some of which is for interventions, which your most recent question has asked about. So what's recently happening, part of the city budget commitment for climate and heat readiness was what's called a Cool Corridors investment through our streets program to accelerate tree planting. The city had an ambitious tree and shade master plan in 2010. 2010 was a difficult time for cities to be making any sort of plans because we were recovering from the Great Recession at the time. And as a consequence of that and many other factors, the city, I think can be argued the needle has not moved very much in terms of tree canopy in Phoenix since that 2010 plan was introduced. So the city has made a commitment in the budget to do more tree planting, and we will see the first generation of that this winter, this planting season. Equity is built into the process in that the strategy that the streets department will use to select streets is built on an algorithm that our research partners have helped develop that tries to quantify all of the factors that people have said over many years are important for where trees need to be planted. But we will also be continuing to layer on top of that public engagement to be sure that the algorithm and the quote experts at the university and in City Hall have it right in the minds of the community members who will be ultimately benefiting from this particular type of intervention. Measures of success, we hear, I believe, what Oscar said as well, and maybe Rob, that the heat illness and death numbers are the ones people are going to be looking at. It is a long path, causal pathway between tree planting and heat illness and death. So I think we are trying to develop some other more proximate measures of success. And for example, for the Cool Corridors program, tree survival in the short term will certainly be one that we're looking to. But I think we as a community, we have a lot more work to do to define these measures of success, both in terms of outcomes and processes and equity and participation.
Yeah, I look forward to that exchange as we move forward in our roles here, David. Thank you. So, Tom, after a long career in air quality management, you made a pivot and decision to focus on housing, particularly housing for our most vulnerable, as a vehicle for protecting people from air quality and heat related issues. Can you tell us why investing in weatherization programs is a solution to mitigating extreme heat, and what recommendations would you have to improve these programs? Oh, you're on mute.
Thank you, Jane, and this wonderful crew of activists and experts. I'm really impressed so far with what's been happening at the conference and all the energy from the youth, from the civic leaders, and the so congratulations. Yeah, I had been working on various green building issues over the years, and climate change even in the early 80s, and periodically after that. And when I looked at the health projections for just the metro areas in California, they were looking at, what was it, 70, 80,000 deaths a year by the end of the century with no adaptation. And when I looked at a lot of our old data from various field studies we'd done, I was quickly reminded that thermal comfort was one of the most common complaints. The buildings were too hot, sometimes too cold. And some of it was due to poor design, some was due to poor construction, some was due to poor operation. So the short answer is that, yeah, buildings, especially older buildings, need to be retrofitted to be a lot more comfortable and safe and more efficient. And now we realize that's where most of the carbon is. We need to be ramping up our retrofits like thousands of homes a day across the country just to meet some of our goals. And other countries are trying to do the same thing in the developed world. Unfortunately, we're lagging in that effort. But in terms of your question, why is it important for health? I've got like 8 different reasons for health. Obviously, with a more thermally safe building, you have a good shelter, people to heat. Even outdoor workers need a place to recover. So if they've got a hot mobile home or shed they're living in, they're not going to be able to recover. Schools can heat as well. It's not just multifamily low income. Schools can have big problems. They have to shut down. Then the parents get up in arms and so on. So you have the hospitalization, you have the emergency room costs that David alluded to, and the deaths, which can mount into the billions of dollars when you looked at the Arizona data. So you have the need to, the benefits of, all these health benefits if you retrofit a building and do it well. But it doesn't guarantee that you're going to prevent overheating, because you can actually create problems if you don't do it well. And I won't go into the technical building science reasons, but people have developed solutions. Basically, the idea is you still need to ventilate it, and you need to design for summer conditions, not just annual average conditions. You need to look at the peak summer conditions, and you need to look at the future, 20, 30 years down the road, because buildings will last 100 years, the shell will. So you need to use that opportunity to improve the insulation, the shading. You can put in brackets to handle heavy duty shading, which you may need in Florida because of the hurricanes. And you can engineer that for current solar heat loads and then make it adaptable so you can extend the shading later. And that can be very cost effective. So the other reasons that have come up in the conference and you hear about are things like grid reliability. Energy efficiency is the cheapest, best option generally. And so the mantra is usually efficiency first. Then you can downsize your HVAC system, your PV system, and so on. Just putting on a PV system is like a Band-Aid. It's kind of like, in the medical field, when you have a health problem, you have prevention where you go to the source and you deal with the source of the problem. And you do primary care and you educate the patient, you eliminate the vectors that are causing it. Then you have secondary care where you maybe put on a Band-Aid or you give somebody CPR. The third level of care is you hospitalize. We want to focus from the health perspective and the climate perspective on the prevention, stop it early on. There's all these co-benefits. So
yeah,
I would just say liability is a big issue that'll be a driver too.
Great. So in just short, because we want to give time for Q&A, could you give any recommendations you have to local governments, community organizations, private sector for expanding, enhancing these retrofit programs? If we really need to accelerate them, whether it's weatherization or multifamily housing, what are some examples of where it's been done effectively?
Well, right now I'm pretty excited that the basic message I've been, saying when I'm trying to help local energy efficiency groups, regional groups in California is we need to, ramp up and do deep energy retrofits. There's now good data to show that just doing piecemeal, lights or insulation or this or that is not going to get us where we need to go. And there's kind of a cost breakthrough curve. If you go all the way, all of a sudden you can get all these other benefits. So, we not only need to do deep retrofits, but we need to scale them up. To do that and get money is usually the limiting factor, political will too. So I would recommend looking at a lot of examples around the country and the world. Block Power right now is getting private and public funding, and they're working in several cities. And there's really great examples where they're doing these heavy retrofits at scale. And Rocky Mountain Institute and other groups are working on this. And the EU has several programs where they can get 90% energy reduction at maybe a 1% upfront cost. So there's a huge payback, and the people don't have to move out of the buildings. So there's a lot of good examples out there. I think the key at the local level is to develop basically working group and task force to break down these silos and bring in the health people, bring in the energy people, and then and then build on the expertise and examples. Because, for example, in California, when we were told by the legislature, you must do a green building because they had done a shoddy job before that for state buildings. We looked at the LEED standards and we realized they were really lacking in, say, indoor environmental quality aspects. And so we basically went beyond LEED. So I would say build on the current best practices, but the field is changing so quickly that we really need to push the envelope. So you need a task force, you need to get funding, private and public, look at the examples, and you need local champions too, and somebody that can stick with it. Because, we put in recommendations for future-proof climate adapted building standards in 2013 in California, and it still hasn't been funded. And not until the LA Times started raising these issues this fall, is it starting to get some traction.
Yeah, thank you. I do think it is a multi-sector stakeholder effort, and it will take some commitment, probably bringing in some outside expert resources in our region. I really appreciate that. I had more questions to ask you all, but I want to turn it over to some of the questions of our participants here. So We have one that's come in here, and it may be, you know, I'll let it may be David or Robert that may be best suited to answer this, but how often are health incidents linked to high temperatures or reported adequately to capture the changes in heat season and populations at risk? And what are the opportunities to improve data collection in hospitals or in any healthcare setting, I'm going to add, as well as education and outreach to healthcare professionals to better understand and recognize heat-related illnesses?
Jane, I'm happy to take a first quick pass, but would love to hear from others. I think the answer to my opinion of the answer to the first half of the question, the first question is not as often as they could be. When surveys are done here in the Phoenix area or elsewhere, maybe a quarter or sometimes a third of the population that say they have some health challenge associated with heat each summer. When we look at hospitalization data, it's very clear that not 1/3 of the population is showing up in the hospital for heat illness. And I think that goes back to your earlier question before, Jane, about measures of success. Should we only be looking at administrative records or looking more broadly? To the second part of the question, opportunities to improve data collection. There's been really interesting conversation here in Arizona around schools and school nurses. Kids show up at the school nurse with symptoms of heat illness that Oscar very clearly described, but there is hardly any consistency or data capture mechanism there. And we know that across the political spectrum, people really care about kids at schools. And if we can accelerate the heat safety conversation there, it could pay dividends elsewhere.
Interesting. This next question may be for Oscar. So do you have a sense of which of the overall contribution of outdoor workers to our economy, or a sense of the overall contribution of outdoor workers to our economy in Southeast Florida? And in addition to OSHA changes, which you mentioned could take 6 to 8 years, are there state policy changes that are needed or possible? And what role can local government play in helping to protect outdoor workers? This is a really important question.
All great questions. I would say for the first point, economic contributions of outdoor workers to the economy, there's a really good report that was recently released by the Union of Concerned Scientists called Too Hot to Work that estimates that if no climate action is taken, outdoor workers in Florida will likely be losing billions of dollars annually in lost wages. And so there's a lot of good data that probably we can follow up and send after this call, perhaps to the attendees, that talks about the economic indicators. Second piece about OSHA, are there state policy changes that are needed or possible? So currently, in the upcoming state session in Tallahassee from January to March, there is a couple of bills that will be considered to try to create a statewide heat standard for outdoor workers in Florida. It's Senate Bill 732 and House Bill 887. It's a bipartisan piece of legislation. WeCount's been supporting this for various years. And so there's an opportunity for county government, stakeholders, civic leaders to support this bill, which would create the first heat standard for outdoor workers across the state of Florida. Locally, there's a lot that counties and cities can do. Tom mentioned task forces. There's obviously education and awareness campaigns. And then I would say that local governments should also consider the possibility of county ordinances or emergency rules tied to heat wave seasons. What are the ways in which we can actually create temporary rules, do the education and awareness so that employers understand when it's coming up, how to take on those measures, and how to partner with worker organizations and government to put them into place. And I think South Florida, whether it's Palm Beach, Broward, and Miami-Dade County, could be leaders in passing local ordinances that would be the first of its kind in the entire country.
Great, thank you. And, funding's always of concern with our local governments. What sources of funding outside of our local government budgets can be applied to the types of intervention, whether it's retrofits, tree planting, and reducing urban heat islands, some of the emergency management features that we discussed? Where are some of the sources of funding out there for these initiatives? Data.
I actually in a discussion recently, I've been following issue, working on it for years. There's Jeff Bezos just gave $5 million to block power.
Yes.
And then of course, federal funding is hopefully coming to supplement that. Local governments that want to go zero carbon are starting to fund this kind of stuff. There's various foundations. I'm also, there's a few cases where hospitals, HMOs, healthcare groups are funding it because it's very cost effective to keep people out of the hospital for things like healthy home asthma interventions. I think we can apply the same logic to heat prevention because ER visits and hospitalization are so expensive for the health insurance. So there's a lot of different pots of money and vested interests out there that we can start tapping into. And I'd still say, you know, when things are still moving so slowly, we're still basically fiddling while Rome is burning. I think we need some good lawyers too. I hate to say it, but you know, whether it's worker safety, student safety in schools, or whatever, it's time to basically push the legal liability issues a lot. It's come up in some buildings in San Francisco where they've been overheated, some condos. And of course, the occupants could afford good lawyers, but that really got the attention of the whole design and building community. I think we need all the pressure we can bear to get the awareness and the funding, the political response.
Yeah, interesting. This is a question maybe for David or Tom. You know, one of the things we're struggling here with in South Florida is getting good data on who has air conditioning and who doesn't, either permanently or intermittently, right? You know, because some, they may have not adequate AC or they can't afford it. Do you have any advice for us on how to secure that kind of data and where you've gotten it?
Well, that's been one of my, it relates to the first question too. I just want to jump in and say data, we definitely need data on housing stock and how people are operating in buildings. Harvard's done a study recently looking at California where they have these heat vulnerability index. And unfortunately, most of them don't include housing characteristics like insulation and air conditioning use and so on. And it turns out that if you add those in, you get much better predictions of heat mortality, morbidity, and so on. Now, UK does routine inspections of homes for safety and energy efficiency. So they've got good data. We've only got spot data in different states and so on. So I say that's a long-term but very important project to get good data on that kind of stuff. UCLA has done some work where they look at building permits, but it's not that accurate. I would say the other thing about data is measure what's important. We should be measuring indoor temperatures and humidity. It's cheap to do. You could do it in schools. You can do it web-based. And we saw this work very well for wildfire smoke where there's affordable particle sensors. And and then people share information. And I just saw a New Orleans case where IC Change, which has a Miami office.
Yes.
They found indoor temperatures were higher than outdoor temperatures during heat waves. And so, and humidity, of course, is a big factor in your region. So I would say start monitoring, and then you can target, you know, you'll quickly find out who has air conditioning, who doesn't, or who has shading and insulation and who doesn't.
Yeah, thank you. Yeah, we're working with the University of Miami, they have some researchers doing some indoor sensors with volunteers. David, do you have anything to add?
I agree with what Tom said, and I really appreciate the distinction in the question about permanent and intermittent.
Yeah.
Data point that gets thrown around here a lot is that 95–98% of homes have air conditioning.
Right.
But as we appreciate, that is totally different than how air conditioning is actually used, which whether it's measuring indoor temperatures or surveys, or maybe looking at energy consumption data, I think reveals that number is a lot lower.
That's really helpful. I think we're in a very similar situation. As we're wrapping up, if listeners today are eager to get more information, the Compact actually held a half-day workshop on heat and managing strategy last month. And if you go to the implementation workshops section of the website, you can view all the presentations from that have a whole list of resources, et cetera, for you to refer to. Thank you all for your comments today. As always, I learn from each of you, and I look forward to continuing these conversations with each of you as we go forward.
Thank you
Thank you,
so
Jane.
much.
Thank you, everybody.
Thank you.
Thank you so much, Jane. And thank you to all of our panelists for this wonderful discussion. Really valuable insights on such an important and timely topic, climate impact that really is far too often overlooked in our region. Next up, we are going to have another pair of concurrent sessions for you to choose from. The sessions are Fertile Grounds, Innovations in Climate Smart Agriculture, or Resilient People and Places, Building Strong, Inclusive Communities. To join the next session, please go back to the CVent portal and click on the link for the session that you'd like to join. Thank you and enjoy the rest of the program.